You could place a pillow for the patient. The thing you want to watch now, what's his position like now?
Extended.
It's extended. Is that what I want it to be if I'm going to be doing? Because if he's already extended into the lumbar spine, what's that going to do?
It's going to ability to move his legs.
What is it going to make it more or less?
Depends which one. It's going to make it seem like he's got a lot more flexion.
It's going to seem like they have a lot more flexion. If he's already pre-extended, then I'm not going to get as much motion in any other direction. So if I'm going to try to assess his rotation, I'm going to get a sense of, wow, that's not moving a lot, but he's already pre-extended because you're already taken up a lot of that tissue slack. Actually, can you, we can give him a, can I get a second pillow? Place this just underneath your arm. This, no, you can kind of lay on top of that crease up there. That'll keep him a little bit more flatter than before, and I'll let that happen. With axial rotation, the way we do it is by lowering the legs is one way of doing that, okay? So if I am lowering his legs to the right, his pelvis is lifting to the, his left side of his, the left side of his pelvis is lifting. What rotation am I testing?
Right.
This is right rotation because his upper body's rotating to the right. He's actually looking that way. Okay. So this is one way to do that. Bring your knees together. There you go. I find the intraspinous space and I start to import a rotational force. Feel the amount of rotation he has, and then move up to the next segment. Move up to the next segment. Okay. And you can kind of go up a bit. Another way of doing rotation, and this is in the Olson book as well, you can, the ASIS, or in this case the pillow, I can grasp the pillow and start lifting the pelvis upward. And that's another way to do rotation. Just one segment at a time, feeling the movement underneath. Okay? And now if I want to do the other direction, the other rotation, I just move to the other side.
You did that. Is it the same as the legs where it's, if you lift the left, he's rotating right?
Yes, if I'm lifting the left side, he's right rotated.
Okay.
His upper body is, if I'm going this way, his upper body is going to the
Got
right.
it. Okay.
Makes
Yes.
sense now.
So this way,
Yeah,
Yeah,
for sure.
right rotation,
I know.
right rotation, right rotation.
I don't know why it
To do
didn't
left
make sense
rotation, I'll
earlier
go to the
to
other
me.
side of the table.
Okay.
Okay?
Yep.
Excellent. Okay. So that's rotation. Can you lay on your side for me? Another way to do rotation we make sure the patient's straight, palpate the intraspinous space. I can impart a posterior force on the pelvis this way. Okay? So now when I impart a posterior force on the pelvis this way, am I testing left rotation or right rotation? This is left rotation now because his pelvis he's rotating this way, so his upper body is turning to his left.
So it's just always going to be the opposite
So
of
I
what the
can do it
pelvis is
this way.
doing.
And this is a good way to get the bottom couple of segments, L5, L5S1, L4, L5, L4, L3, L4. After that, it starts to become a little bit more difficult. So now what I can do is I can switch and come from above and start at, I can do this starting at T11, T10, assess the amount of motion. But when I go this way, what motion is this? Right rotation. So when you start doing this way, you got to remember which movements you're assessing. This will be okay until L2, L3 level, but not really for the lower segment. It's going to be very hard for me to induce that much rotation to get down that far. So just another way of doing that. Okay. Let's do side bend. Let me have you lay on your stomach again. Yeah, you just need the same thing. So there's a couple of ways to do side bending. One's in the prone position, and the idea is to take the leg and laterally deviate it, abduct it, to start imparting a side bending into his lower spine. Okay? When I am moving the leg outward this way, am I assessing right side bending or left side bending?
Right.
Yeah.
Right side bending. I'm approximating his ilium to his thoracic spine on this side, so that's a right side bending. having control. So I'll move the leg out until I feel that start to move underneath my finger. Move up to the next intraspinous space and wait for that to move. And I'm assessing how much it moves, reactivity, if it's painful. Same, just working my way up. I can do that for right side bending, and I can do that for left side bending. Okay? All right. Let me have you lay on your side facing me. An alternative method for doing side bending. Patients on their side. Make sure that the spine is straight and not pre-rotated. It's the neutral before you start. Bring the knees up to about a 90-degree angle. And now, what I'll do, I'll palpate L5 spinous process, get into intraspinous space, and start lifting the legs up towards me. And I will feel for the movement of the inferior spinous process, that amount of movement. I'll move up to the next one and impart more lateral flexion. And then as I go up, I'll impart further and further lateral flexion. Am I testing right side bending or left side bending now?
Right.
This is right side bending. Again,